The World Health Organization has warned that more than 1.4 billion people, that is a quarter of the world's adults, aren't getting enough exercise, putting them at risk of deadly diseases. The WHO says the consequences could be fatal, with 1/3 of the world's women and a quarter of men at a high risk of conditions like heart disease, diabetes and cancer, unless they up their activity levels. The risk is highest in Kuwait, American Samoa, Saudi Arabia and Iraq, where more than half of adults don't get enough exercise. That's compared to the best performing countries, Uganda and Mozambique, where 94% of people live an active lifestyle. The WHO says technological advances like escalators and sedentary office jobs means people are moving around far less. But it says doing simple things like 2 hours of moderate exercise a week, like walking, or 75 minutes of vigorous activity, like a team sport, would improve people's physical and mental health. Let's get more on this. Gregory Knell is a researcher at the University of Texas Health Science Center in Dallas. He joins me now. Many thanks for speaking to us on TRT World. Are you surprised by any of the findings of this report?
I'm not particularly surprised, but the scale of this report is somewhat staggering and kind of sends a message to us as public health professionals that this is a much larger issue than any of us maybe fully understood at a worldwide scale.
What is the most striking revelation to you in this report?
I think that the trend that essentially what we've been doing as public health officials and those promoting physical activity over the last 20 years has essentially been ineffective. The prevalence of physical inactivity over that period of time has remained relatively stable. So doing more of the same is simply not worked. Telling individuals to be more active and to get exercise is not the solution, and we know that. Based on this report, that approach is not working.
Do you have any suggestions on what a practical solution could be?
Well, as you kind of mentioned, what we've done in the United States and in many places, we've systematically engineered physical activity out of our lives. So we've made being physically inactive the easiest and most convenient way for us to live our lives. So we have to turn that around, and we have to make being physically active the most convenient and the easiest way for us to live. And that, I think, starts at the top with policymakers, and the public needs to demand that physical activity is made a priority.
Okay, Gregory Knell, interesting to talk to you, researcher at the University of Texas Health Science Center in Dallas.